So yes, this is living with EDS number 2. My name on Eventbrite is Zebra Support Network. So I have several accommodations. Oh, I forgot to turn on captions. I knew I forgot something. Enable live transcript. Otherwise, Dad won't be able to know what's going on. Okay. So I have several accommodations like visual description, captions, sensory safe space, distraction free zone, and no trigger/trigger warnings so that this can be accommodating to all. So here's a photo of many people with many different disabilities, some with wheelchairs, some with canes or crutches, and it says access for all is love for all. And then you can find my first workshop on my website or my YouTube channel, which is called Live Well with EDS. So I'm just going to go over the workshop overview. I'm going to go over the treatment for EDS and physical activity in EDS, what's safe and what's not, the life cycle of EDS, EDS and insurance, and then being a student, being a parent, and like with EDS, and then supporting a child with EDS. And then also something that I'm sure that we've all had to deal with, when to go to the hospital versus when to go to your doctor. And then also another very key thing, getting diagnosed and choosing a mobility aid, as well as dealing with doctors and rights of people with disabilities. A lot of people don't know anything about their legal rights and what they can do about it. And then at the end, there will be a Q&A and a support group. And then one of my favorite quotes about EDS, it's white text with a teal background. It says, "No other disease in the history of modern medicine has been neglected in such a way as Ehlers-Danlos syndrome." Just want to make sure. Okay, I am recording. Yeah, so I'm just going to introduce myself very briefly. I'm the founder of my charity, Community Medical Solutions, and I run Zebra Support Network on Eventbrite. Medical ableism has negatively touched my life in many ways. I decided to turn my negative experiences into positive change by teaching people like me how to turn what they see as their greatest weakness into their greatest power. I've had chronic pain all my life, but thought it was normal because of lack of awareness for chronic illness. I now do outreach programs for kids and teach diagnosed teens and adults how to cope with the physical and mental aspects of chronic pain. And then in the bottom, there's a photo of me with my electric scooter and a photo of me in my wheelchair. And also a quote that says, "Having hypermobility is not always beneficial by any stretch of the imagination." So here, because my first section is mostly about pain and treating pain, it's about the cycle of pain. So it starts with anxiety. You tense up your muscles, your heart rate increases. There's a lot of stress hormones that impact your digestion, and then that leads to, and usually the anxiety is triggered by pain, not that anxiety just makes pain out of the blue. Also, this is definitely not to say that all pain is caused by anxiety, but I do know that when I can control my anxiety, or at least notice when and how anxiety interferes with me taking care of myself, it does help with my physical pain. So anxiety leads to more pain, because you might neglect yourself, you might tense your muscles or not sleep. That leads to anger and frustration and hopelessness, from like medication side effects, financial concerns, medical concerns, which leads to insomnia, from career disturbances or hospital visits, depression and fatigue, which leads back to anxiety. And then there's also a photo called "The Do's and Don'ts of Persistent Pain." Don't blame yourself or fight the pain. Don't assume persistent pain always means damage. Don't rush or panic if you flare up, because again, that's, you just clench everything and that just adds more pain to your already severe pain. Don't believe everything you hear or read, don't fall for the miracle cure that somebody's selling you on Instagram, and don't rely on scans or tests to tell the whole story. Sometimes, like with fibromyalgia, scans and tests don't tell the whole story. So here, this section is all about non-drug treatment. This is the easiest to get. It's the easiest to understand as well. So why choose non-drug treatment? Little to no side effects. It's not covered by insurance, so you don't have to deal with insurance. It's covered by a flexible spending account or a health savings account. It's relatively easy to get. Some of these are, very common treatments, or you don't need a special prescription or a special pharmacy to get them. Some meds you do need a specialty pharmacy or pre-authorization and then authorization, and then you can finally get it. Sometimes you don't need a doctor to get these. They are often generic and cheaper, and usually you can choose these yourself. So there is acceptance and commitment therapy. Accept what you can't change and commit to what you can change and can do. CBT, change how you think in response to distressing thoughts and feelings, specifically about your pain. Somebody might have pain and then just not want to do anything, even though pushing through pain in a very specific way could be beneficial. I definitely used to run away from all pain at certain points in my life, and that just made things a lot worse. But also know, obviously when the pain is a sign of something that you do need to back off from. Forgiveness, forgive yourself and others for mistakes you made on accident. Use pacing, delegating, and adaptations to reduce pain and fatigue and muscle strain. There's biofeedback. You control your heart rate and breathing to control pain, headaches, and even GI issues. Mobility aids and orthopedic braces help you get around, help you walk with less pain or injuries. There's progressive muscle relaxation and stress reduction. Like I was mentioning earlier, when you have anxiety or even just stress, you tend to clench all of your muscles, and that can definitely add to your pain. And then there's movement like hydrotherapy, or even non-movement things like massage and acupuncture, which can help some people for sure. And then also things like hot and cold additionally can help people. So these are more specific electronic or technology-driven non-drug treatments for pain. There is pulsed electromagnetic field therapy, which I do personally use. It uses magnets, like a magnetic field, to relieve pain and repair cells. It sounds wild, but there's a lot of evidence that points to it working for specific conditions and for general pain, migraines, fatigue, and even GI issues. There is a TENS device. It's an at-home device that electrically stimulates the muscles and nerves to relieve pain. There's cryotherapy. It triggers your body's healing response. It has an impact on reducing the symptoms of many conditions like neuropathy, nerve pains, migraines, arthritis, and much more. And then there's red light therapy, which I also use. And this uses a very specific frequency of light, which happens to be red, to help your cells regenerate faster. And this also helps with fatigue and pain and headaches and migraines. And here is a photo with a pink background with pills that says, "Don't be ashamed of your medication. It helps you function and live. What's bad about that?" A lot of people do have shame about taking medication when it just helps them be to the level of quality of life that they need to be. So first of all, types of meds, there are, your everyday meds, and then there are specialty or compound medications. These are always given by a specialty pharmacy, which your doctor will know how to work with. These are things that are not used super commonly, maybe things like low-dose naltrexone or ketamine pills. things that are usually newer, but they definitely can help, especially if you've tried all the normal meds for pain. Then there's meds for a lot of different things, specific conditions, and then also pain, fatigue, GI issues, and nausea, appetite, as well as mental illnesses. There's psychiatric medication. And then if you have issues with gastroparesis or malabsorption, which is comorbidity of EDS, there are things like patches, which are 7 days, or IV medications. If you have a PICC or a port, or things that you could put in with your feeding tube, basically if you have a feeding tube because of gastroparesis. So then pros and cons of taking medication, you need a doctor and insurance. There's a lot more options than generic meds. You can have side effects, but a lot of them reverse when you stop the medication. They can be very helpful, but can also be less effective over time. Gastroparesis and malabsorption, as well as intestinal and esophageal dysmotility and MCAS or idiopathic anaphylaxis can all interfere with how you take medications or the type of medications that you can and cannot take. And then it takes a lot of trial and error to get on the right mixture of medications. Usually one pill will not solve all of your problems, and you will need not one, but multiple medications to help you get to the level of quality of life that you need to be at. So then there are also procedures which are non-invasive, usually injections that can definitely help your pain. I do trigger point injections and joint injections of cortisol, but I've also been recommended prolotherapy, and I'm planning on getting an epidural. I'm just going to start at the top. Prolotherapy uses a mild irritant made from sugar, I believe, to trigger your body's natural healing response, which helps heal things, basically using your own body that kind of kickstart a healing response when you're having issues healing an injury. Joint injections of cortisol or even hyaluronic acid helps with pain, mobility, irritation, inflammation, and swelling, specifically in the joints. They're injected in the joint cavity, but then you can also get cortisol as an intramuscular injection. Then there are trigger point injections. A local numbing agent like lidocaine is injected into the most painful spots, usually in the back. You can get anywhere from 10 to 20 of these very small injections, basically in one procedure when you're doing the trigger point injections. And then an epidural, a large needle with some numbing agent, and it helps. Well, for me specifically, it's been recommended with pain from a pinched nerve. Usually people know what epidurals are because they are commonly used with pain from pregnancies. And then you can also do a nerve block injection if you're having severe nerve pain, and you can figure out which nerves are basically messing up your pain levels. So then surgical intervention. Why would you have surgery? It can be a permanent solution to a permanent or even progressive problem. Well, actually, this is more like the pros and cons. You can have some serious complications with EDS/HSC, expensive surgeries, even like surgeries are expensive even with insurance. Sometimes it is a rather painful, long recovery. You have, on average, 3 to 4 times longer healing with EDS, and then you can also have more poor wound healing with EDS. And it also kind of depends on the type. So then if you have you can have serious long-term issues if your surgeon is not skilled enough and messes up the surgery, maybe even leading to needing multiple surgeries. And then you need a really good and trusted doctor, obviously. Some problems um, only have a surgical intervention like a tethered cord. Learn the difference between a procedure of like getting a feeding tube and a surgery like fixing like a spinal fusion. And then EDS patients have issues with anesthesia not working and slow and poor healing. Personally, anesthetics don't work on me. I wake up during surgery. EDS patients also have atrophic, which is raised, thick scars. You, you know, people who care about their appearance. Sorry, 2 seconds. Yeah. I just want you to stay inside right now. Okay, we're not gonna go outside. Oh, yeah. Oh, okay, yeah. I'm not going anywhere. Yeah. Oh, I feel like garbage. I'm not going anywhere. Sorry about that. Yeah. So, and then you will need physical therapy, maybe even occupational therapy after surgery. And then movement. Movement in a controlled setting can be healing and strengthening. There is occupational therapy, which helps people do things that they want or need to do through the therapeutic use of daily activities. And then there's physical therapy, which are therapeutic movements to strengthen your muscles around the worst joints. Hydrotherapy, being in a pool, provides full body, low impact exercise, adaptive exercise, exercise that is safe for a disabled person's specific limitations and mobility needs. If you're in a wheelchair, there's stuff like wheelchair basketball, skiing that's sitting down, and so much more. And then specifically for EDS, if you like adaptive yoga, I use something called the Zebra Yoga Club. It's the largest collection of videos of yoga for EDS by a licensed yoga instructor for only $13 a month, which is less than any single class that I've done for adaptive sports. So for EDS specifically, exercise stabilizes joints by building muscle. It increases irisin, which it burns fat, improves endocrine function, slows aging, improves insulin resistance, cognitive function, and cardiac health. It reduces pain and balances chemistry through hormone management, which encourages a healthy sleep cycle, decreases stress, and helps prevent depression and anxiety. It also boosts immunity and prevents illnesses by supporting production of antibodies and T cells. Movement is a medicine for creating change in a person's physical, emotional, and mental state. And then, so the do's and don'ts of exercise for EDS, you should exercise muscles to protect joints, and you should not stretch before, during, or after. You should practice cardio for heart health, and you should not do high impact activity. Obviously, that usually leads to some kind of injury. You should protect joints during exercise, and you should not do open circuit exercise. You should do closed circuit exercise, and you should not overextend your joints. So usually it helps to have a spotter or a mirror and watch your joint alignment, or even have a brace with a hinge so that you physically cannot hyperextend. And then you should exercise at the appropriate level for your limitations, and you should not push past fatigue and soreness. And then protect your neck and back, and don't take too many days off. Like, even if it's just a little bit, it helps to have regular exercise, and add to your exercise routine slowly. Do not overload joints or muscles. So yeah, always consult a physical therapist before exercising or starting your fitness program. make sure that's low impact and take into the other conditions like positive and the right-hand corner there is a photo of somebody completely wrapped in KT tape, and it says, "My experience using KT tape for Ehlers-Danlos syndrome." And then this is about the myths, like true and false, about pain. So I should say, basically,
You're breaking up, Emil.
is this better?
Yes.
Okay. So, obviously, there are definitely times when staying in bed and resting is good, but especially when you feel bad all the time, you can't always be like resting, even if it's just pushing your wheelchair, it helps to be active or do some kind of therapeutic movement like swim or adaptive exercise or occupational therapy. So returning to movement and work is better for recovery and preventing recurrence than constant bed rest. Immobility and bed rest for more than 2 days have never been shown to be beneficial. Strong painkillers like opiates will help manage my pain. False. Solutions that focus on opioids for managing pain at best mask people's physical problems and delay or impede recovery, and at worst may prove to be dangerous or deadly. Yeah, so and then also opiates can actually make your pain receptors more sensitive, leading you to feel more pain. And then surgery is my only chance of improvement. Obviously, depends on what you have, but this is definitely not always true, especially if you have EDS. A lot of complications can happen with EDS, leading to long-term issues or you to need more surgery. And then my pain and limited function means there's nothing I can do. That's always false. People who catastrophize about the meaning of pain are trapped in a vicious cycle of avoidance, behavior, pain, and disability. Physical therapists can help interpret pain and use exercise to break the cycle and reduce pain. And also, actual therapists can help you understand the meaning that you put behind your pain and challenge these core beliefs that you have about yourself and your disability. And then a scan will give me a diagnosis. X-rays, CTs, and MRIs can be helpful, but often they can't point out exactly where you're having pain or why. And then I'm causing damage if it hurts. False. The level of pain experienced is often a poor measure of injury or tissue damage. Even if an activity is painful, it is not an accurate sign of doing harm. A physical therapy therapist can help develop a program for you to move safely. And bending and lifting will make my low back pain worse. It may be painful to bend and lift with back pain, but developing the mobility and strength to bend and lift is important. Many types of exercise, including weight training, can bring great benefits. I mean, for me, I use like very, very lightweight, but even that, I've noticed a lot of benefits from it. So this is going to be all about living with EDS and how it progresses. So EDS, as we all know, is progressive. The type that you have greatly impacts how your condition will affect your future. It all starts with hypermobility and mild chronic pain. You'll notice hyperextension. You may have GI issues, weak muscles and teeth, and eyesight issues that get progressively worse. You may get osteoarthritis or osteoporosis, skin involvement such as skin tearing, or scoliosis or kyphosis. You may have pneumonia or a collapsed lung more easily than the average person. And it may take you longer to recover than the average person. For example, I believe it's classical or classical like EDS. People actually have collapsed lungs more frequently than the healthy average person. And then in the later stages, usually as well as more dislocations, people notice a lot of sprains, strains, breaks, and fractures. You may develop gastroparesis, intestinal dysmotility, or malabsorption. You may have prolapses, TMJ, migraines and headaches, back pain, craniocervical instability, or AAI, which are spinal instability in various places. And then you may also discover a tethered cord. And then also, if you have vascular EDS, you can have aortic ruptures, vascular events, cardiac events, or just general issues with veins, as well as your EDS progresses. I believe 50% of people have an aneurysm before they turn like 25 with vascular EDS, but I'm not sure what type. And then here are two quotes. One says, "My disability is one part of who I am." And then the other says, "My ability is stronger than my disability." So this is about being a student with EDS. Use your Disability Resource Center and disability accommodations. Use occupational therapy and physical therapy. Find ways to be adaptive, which is also on the next slide. Find a supportive community. Advocate for your needs, especially access needs, if they aren't being met. Use the correct mobility aid and take sick days as needed. Choose or transfer to a school that fits your access needs. Don't forget to take care of your physical body. Be mindful of your diet and sleep. Use paratransit or ADA transportation, which is free or low cost. Get involved in adaptive sports. Try adaptive clothing. My favorite is Tommy Adaptive. Ask for help and delegate responsibilities. Don't be afraid to, quote, look disabled. And then also usually there will be accessible housing on campus that you can use. Some schools even have accessible like shuttle transport that you can utilize to go from class to class. So just be mindful of all the different resources. Also, some schools have scholarships for different disabilities or any disability, which helps. So this is all about being adaptive. Being adaptive helps you reduce pain by reducing the strain on your body and making sure that you do not go over your limit. Here are some examples of being adaptive. If you struggle to write, use ergonomic pens or pencil grips. Use voice-to-text apps if you have serious issues with your hands for longer notes. Use the correct mobility aid for your level of limitation. Be okay using different aids for different days. Use braces, KT tape, bandages if you need extra support. Find resources for adaptive exercise and wheelchair yoga or cardio, weightlifting. Adapt activities so you can sit as much as possible and don't need to lift anything. For example, I would bring a stool over to the kitchen and cook just fine. Here is a quote with a blue background that says, "People with Ehlers-Danlos syndrome tend to minimize their pain to try to seem as normal as possible. We don't want to be perceived as complainers, so we keep our pain to ourselves as much as we can." Being a parent with EDS. You could get a caretaker covered by insurance or a state program. Delegate tasks to willing friends and family. Use pacing and have rest breaks. Have emotional support like a disability therapist or life coach. Understand how ableism impacts your mental health. Don't feel ashamed of your limitations, needing medication, or having help. Don't be scared of looking disabled. And then being a parent of a child with EDS. At the bottom, there is a quote that says, I wouldn't change you for the world, but I would change the world for you. Let your child know disability is not a bad thing and it is not always negative. Advocate for them and teach them self-advocacy. Help them with medical things. Educate others on disability and ableism. Make them feel like every other kid. Help them get SSI, a caretaker, and paratransit services if they need it. Help them adapt to inaccessibility. Support their interests and teach them how to manage EDS. You should be able to unmute yourself. Is there anything that you want to add, Dad?
Well, I do think it's important as a parent with a child with EDS to, to be an advocate and, the whole don't look disabled. You just hear these stories of parents who were ashamed because their son or daughter is in a wheelchair, has to use crutches or a mobility aid, and it's it's about helping your child and not about the image
helping your
of it.
fucking ego.
Yeah, exactly.
No, like I literally know somebody who's a minor, and his mom won't let him use a wheelchair because it means that he's, quote, lazy and will, quote, embarrass her. Oh, and then another thing is help your kid get a diagnosis early if you suspect hypermobility. Like if you guys knew what EDS was, would you have tried to get me diagnosed early or late?
Oh, absolutely. I mean, if we knew, because it did take a while to get a diagnosis, but if we knew what it was,
awareness. Because this is why awareness matters.
Yeah, and we could have gotten ahead of it where you would have had less time where you were just in absolute pain and uncertainty of what it was. So yeah, definitely getting ahead of it early is important.
I had so many like sprains and fractures and all this stuff, and I had no idea why. We also didn't even like think that it was weird somehow. We just thought that it was clumsy. And now looking back, I'm like, it was all EDS. But yeah, I feel like that's everything for parenting a child with EDS. Yeah, so you can mute yourself again. So this is the invisible illness iceberg. So I love this. Usually people, when they see me doing something, they'll be like, oh, you're better now, right? The reality is, when you do something, there's always a cost. Pain, fatigue, risk of injury. So people see you socializing, exercising, going to school or work, doing chores, shopping, gardening, looking after your kids. What they don't see is isolation, chronic fatigue, depression, anxiety, and hopelessness, medical bills, and overwhelming financial stress, loss of hobbies, careers, meaningful work at all, insomnia and lonely nights, loss of support from friends and family, debilitating pain, loss of cognitive abilities and memory, and also loss of mobility, as well as just ableism, straight up ableism. Yeah, so, and then on the right side.
If I could break in, before we move on, because you asked about being a parent of someone with EDS, I wanted to ask, is it Sarah? I'm sorry, I'm terrible with names, but when you were going, first having symptoms, did you said you were still in school. Was that something your parents kind of jumped in on, or did you try to kind of keep it to yourself because you didn't want to, be a complainer, or you wanted to be fine?
I completely relate to this. at the time I first started having symptoms, there was not a lot of published material about it. And so I think just in a real effort to try to help and get me resources, my parents sent me to Children's Hospital here in Seattle, which should have been great. They should have known what I had and they should have been able to help me. Instead, I was put into a teenage chronic pain program, which meant 10 hours a day of rigorous PT.
Oh my God.
If I couldn't hold my shoulders the way back I was supposed to without subluxing, they would duct tape them. And
Not
It-
even KT tape.
that wasn't
Wow.
around then. Yeah. So it was duct tape.
Oh my God.
And so not only was it not successful in treating my pain, but I quickly realized the only way to stop being physically tortured this way was to say I wasn't in pain. So I actually graduated quicker out of that pain program than any person had before me. But then I look
You're like
back
the
and I
star of their
see-
program.
I look back and I see that they're still recommending, especially young women or people who are surmised by their looks to be reflective of their health or pain. That it's difficult because that pain program really didn't address why you were in pain whatsoever. It was sort of like, here's how you'll fix the pain. Good luck.
It doesn't sound very tailored to anything, like
No.
yes.
And they don't
you
have
have to have low impact exercise and a lot of breaks. That doesn't sound very nuanced at all.
No, it wasn't. It was more to try to just build strengthening in any way possible. But the reality is it probably sent me to needing these joint repair surgeries. I've had 6 shoulder repair surgeries, 5 hip surgeries, 2 with cadaver tissue, a hernia surgery. I've had probably 6 or 7 stomach surgeries to work on either gastroparesis or severe acid reflux. But all of these things, if we'd had knowledge sooner in childhood, I was always the person playing sports that would sacrifice their body for the ball. Oh, I can flip while running? Great, I'll do that for my lacrosse team and then I'll be the star. And I was rewarded for that, for those injuries. And that made it more difficult later in life to realize, hey, I think that put you needing surgery faster.
Yeah,
because
because
you don't
later
know
in
the
life you
preventative
aren't
medicine.
rewarded for this.
Exactly. There's still a very ableist idea when it comes to, I hate when someone stops me in the grocery store and they're like, oh, if I couldn't run down a beach, I'd kill myself. And I always say,
Oh my God.
you
Yeah.
know,
I
just
love when
because I
people say
can't
that.
run down the beach doesn't mean I don't get to go to the beach, A, and B, doesn't mean I'm not enjoying my life and it isn't any less beautiful than yours.
Walking isn't everything. And I'm
Yes.
like, really? You would end all joy because you couldn't walk, but could still get around.
Yes. It's such a sad fear-based idea, right? Like I'd rather be dead than not have my abilities, not realizing that, you'd be devastating the people who loved and cared for you. And I think whenever somebody does come into disability, they do feel that extra sense of burden because of such media and movies and TVs that really portray, yes, it is a burden to care for someone with a disability, so much so that people, when they're disabled, become very suicidal often because of those negative stereotypes and impacts, right? It's such a cascading issue.
Yeah, because also it's just the issue of people, if you hear from everybody that if I was in a wheelchair for the rest of my life, I would kill myself, you would believe life isn't worth living if you can't.
Oh yeah, or if you were young and you heard that and then later needed a wheelchair. I mean, there's so many instances where I can think of how unmeasurably damaging those things that are internalized by patients.
I was even there, like from hearing others say that I remember one time I saw this thing about, it was a thread about, how have you seen people ruin their life? And half of it was talking about people just basically becoming disabled. And all the comments were, well, if I was blind for the rest of my life, I'd kill myself. Or if I was in a wheelchair or if I was deaf, I'd just kill myself. And I was like, seriously? Being blind, I obviously, there,
Not
it's
that anyone
not
wishes
ideal,
those.
but it's not like painful or life ruining, and you can do so much while blind, and people just ignore that fact.
And not only that, there are resources. My friend Julia Vidal
Yeah.
works for the Washington State Department for People with Disabilities, and she worked with the blind and deaf communities and was quite shocked,
yeah.
A, that
I know
blind
somebody
and
who's
deaf
blind,
communities
deaf,
don't really
and
get
trans
along because they have
and
such
gets
different
around so
needs.
fine.
But they also have a whole system set up where if you're blind, you can call a helper to come pack your bag, to travel with you, to make sure you get to the right room. These things are all set in place through usually state departments of health, but they vary state to state. So our country has a completely inaccurate across the whole country, depending on what state you're in, what kind of resources you're going to have for what kind of disability you have. And that's unacceptable. It needs to be universal for all the states to provide that same. Otherwise, we're going to find that some disability communities in certain states are not able to thrive whatsoever, right? We have to start on an even playing field for everyone.
So I know we have
I
a long way to
completely
go, but have you found in the last 5-10 years that the level of awareness and resources has increased at all?
Oh, yes, certainly, especially in the last 5 to 10 years. When I first started looking for specialists who had understanding in this, it was often out of state, or I'd have to meet many other people to get the name of somebody who might work in this area. And now what I see is, even so with my dysautonomia, I receive IVs twice a week at my hospital for my infusions, and they help with my tachycardia and blood pressure and all of those autonomic nervous system symptoms that I just have dysfunction regulating and can have issue with. And it also helps me keep my blood pressure high enough so I don't faint, causing more injuries and potential surgeries. But it's such a great effective treatment, and it's often common with Ehlers-Danlos syndrome that dysautonomia syndromes exist together. And just in the last 3 years, I went from seeing a group of maybe of 800 of us, probably 10 of us had either infusion treatment or ports, to now it's something like half, like 400 of us have that kind of treatment plan. So I do think that there's probably more awareness right now for dysautonomia because of its potential relation to long COVID and long COVID patients developing dysautonomia afterwards. So it's actually probably going to get more research and attention and money and funding and just all the right people looking at it more so than Ehlers-Danlos is because of its relation to this moment and how important and how impactful COVID has been in everyone's lives.
Mm-hmm. Yeah.
But I
So
am excited because, often I meet other advocates who say, well, why should I advocate? Other people are doing that, or somebody else is also doing a webinar. And my answer always to that is, but we're
why not
stronger
have
together.
more?
Yeah,
But
literally.
also, we
What is
all
the
have
message?
unique experiences, so we all have something very special that we can
Yes.
bring to the table. Maybe
Exactly.
somebody makes their own graphics, or somebody has a special perspective on accessibility, or
Exactly. And
somebody is
regardless of
LGBT
their,
and has EDS, or somebody has MCAS and EDS.
yeah,
We all have our own story, or somebody has addiction and EDS, so they can talk about
exactly.
how
Well, and
pain pills and
when I
not
show
having
up at
follow-up impacts it. Like, it's so important for all of
Yes.
us to speak up, not just one of us to speak up. In
That's
the
the thing.
mentality of well, one person is speaking, so why should I? It's so backwards.
I have other advocates say, oh, well, you're going to that meeting, so I don't have to. And my retort is always, when I show up and I advocate for my patient community, I will always do that. But what kind of message would it show if all 800 of you came with me? And so it wasn't just me saying, this is me advocating for 800 people who can't come. You all came with me. That would make a huge change. That would be
That
impactful
awareness
to the
and-
people at the meeting, saying, whoa, there are that many people and they do need this much help. But it's hard to get people to work together in that way and understand that big picture. And it's also
mean-
just hard with the condition of Ehlers-Danlos and being able to consistently show up or do things sometimes, right?
Yeah.
We're kind of battling
Consistency
those
is
two
so
things.
hard with EDS. Yeah, so
Exactly.
I think maybe a third of the way through. So I feel like we can talk more at the end, and
Oh, no,
then
please
if you
continue.
have
I'm so
any
sorry.
more,
I think
no,
I might
no,
have to get
it's
off the
okay.
call at 6, but I'll stay as long as I can.
Okay, yeah, that's fine. Yeah, and then if you have any questions, you can just unmute yourself and let me know, okay?
Will do, and I'll email if there's anything else I think of afterwards too.
Yeah, yeah, that's perfect. I'd love to hear more from you through email.
Oh, likewise.
Yeah, yeah. So I'm gonna go back to the presentation, but yeah, just feel free to let me know if you have any questions. Yeah, so here's another quote. You know, a lot of people think that EDS is just being flexible. This says hypermobility does not just mean I'm flexible like those circus performers. So this is about when to go to the hospital and emergency room versus urgent care. So go to the hospital when you have a dislocation that isn't reducing, when you have extreme out of the ordinary symptoms that could indicate something very serious like sepsis or a vascular issue, when you have heart issues or trouble breathing, when you're fainting or vomiting from pain, or when you have multiple dislocations. Emergency room versus urgent care. Some people still don't know this, so I'm just going to cover this briefly. ER, when you may have life-threatening symptoms or it needs to be addressed. Basically, right now, urgent care, when your pain is an emergency or your symptoms are an emergency and you can't get access to anybody else who can treat you, basically. So, and then when to call your doctors. Normal hours. You have an issue that needs attention in the next 24 to 48 hours. You need a medication adjustment, mobility aid, you need a joint stabilized, you had a dislocation and it still hurts, you have lasting pain that's interfering with your daily activities or quality of life, you have pain that's interfering with mobility, stability, and strength. And then after hours, a lot of PCPs have an after hour number. You cannot wait for treatment until the next day. You need advice on if you should go to the urgent care or the ER, or just wait until the doctors open up. You're having severe side effects from a medication that could be dangerous. You're having severe symptoms that are out of your normal range. You suspect that you've been injured and you need that treated. You suspect that you need urgent medical attention that is not life-threatening. So I had this asked last time that I was having an event, EDS and insurance. How does EDS impact life insurance? So unless you have vascular EDS, you should not have any issues getting life insurance. There also are special insurances for life-threatening conditions. Chronic illnesses can make life insurance more expensive, but you can still get good premiums. And then how does EDS impact medical insurance coverage? The most important thing is to maintain insurance coverage throughout your life. Currently in the USA, it is illegal to terminate insurance or jack up the price due to a pre-existing condition. This is about mobility aids and EDS. The photo is of the same girl with many different mobility aids. In one, she is just standing, and one, she has a cane, and the other, she has a power wheelchair, and then in another, she has a manual wheelchair. So choosing the right mobility aid. There's a photo that says your body, and it shows a skeleton, and then your body with EDS, and it shows a skeleton with the joints out of place and in a very wonky position. So a wheelchair is great for people who have too much weakness, instability, or pain to walk. And then also, there's the difference between a power chair and a manual chair. Forearm crutches, great for people who can walk, but crutches strain the wrists and shoulders too much. Then there's a walker, more support than a cane, and it lets you sit when necessary. There's a life glider, which is a hands-free no-fall walker that lets you sit down whenever needed. It's also lightweight and foldable. This is what I use. Then there's a cane, good for mild weakness and balance issues, but not the best option if you have wrist subluxation or dislocation issues. This is a section on getting diagnosed. Here is a quote. Many people with Ehlers-Danlos syndrome do not receive a diagnosis until they are well into adulthood and have suffered for many years with ill health, after often undergoing increasingly invasive tests. That's why investing efforts in better understanding rare diseases are so important, not only for improving patient care, but also for realizing efficiencies in the system. How to get diagnosed. Geneticists doing a genetic test, unless you have hypermobility type. And so there is a hedge study through the EDS Society to identify the HEDS genetic variants, and then Cascade Genetics, which I just heard about, thank you, does virtual cash price visits for everybody, which is amazing. For hypermobility type, there's a questionnaire and the Baden hypermobility test. A rheumatologist can also do the clinical test, especially for hypermobility type. The EDS Society has a directory of EDS specialists. There's an EDS treatment center in New York. Tessa Colina in Pomona, California is another treatment center. You can find some other treatment centers, but those are the main two. And then others that have some like EDS specialists or maybe even a team. There's the Mayo Clinic and then OHSU in Oregon. And then this is about dealing with doctors. So the psychological damage done to patients with hypermobility is often immense and will take years to heal. This kind of damage has a big part of my own story, so I know all too well what it is like to be dismissed, told you are making things up, or simply told you cannot be helped. The cruelest symptom of our illness is disbelief by medical personnel. So dealing with doctors, there is ignorance and neglect and malpractice. For ignorance, give information on EDS, show your history of issues that align with EDS, explain all of the doctors that have suggested you have EDS or confirmed it, have an EDS specialist contact your PCP and educate him, advocate for yourself, give official informational resources, have a doctor that knows EDS explain the symptoms and impacts to that doctor. For neglect and malpractice, stand up against invalidation, prioritize self-respect, change doctor if possible, hire a patient advocate, file a report, educate yourself on all the side effects of your meds, make sure you aren't misdiagnosed if you suspect a lazy diagnosis. Due to the limitations we currently face, we're excellent at thinking outside of the box and solving problems creatively. We also develop great mind-body control due to pain management. We're strong, witty, and brilliant. And then this is kind of about self-advocacy in the area of knowing our rights. The self-advocacy is the ability to articulate one's needs, make informed decisions about the support necessary to meet those needs. What gives disabled people rights? The Universal Declaration of Human Rights, the UDHR, the International Covenant on Civil and Political Rights, the ICCPR, the International Covenant on Economic, Social, and Cultural Rights, the ICSCR, the Inter-American Convention on the Elimination of All Forms of Discrimination Against Persons with Disabilities, the CEDPWD. Knowing your rights. In public places, the rights persons with disabilities have include freedom of speech, respect for privacy, the right to both marriage and family, the right to education, the right to health, and access to public spaces. In the workplace, you have access to reasonable accommodations and no discrimination. You do not have to disclose your disability to your employer. Anti-discrimination, equality before the law. Laws in America prohibit discrimination against persons with disabilities in any educational, workplace, public programs, private housing, or access to polling place. So the rights of a service dog owner. Many people with EDS own a service dog. In nearly all states except for six, there are laws that protect assistance animals from criminal interference, theft, and assault. Only Alabama, Alaska, Iowa, Maryland, Montana, and West Virginia do not have such laws. Also, all of these, except for 5 states, which are Hawaii, Michigan, South Dakota, Washington, and Wyoming, cover. So these 5 states do not cover service animals in training. Every other state does indeed cover service dogs in training. Laws protecting disabled pedestrians, typically known as white cane laws, appear in most states. About half the states offer licensing fee waives and exemptions for service dogs. About half of the states offer licensing fees for service dogs. Finally, more than half the states have laws that make it a crime to fraudulently represent that a person has the right to be accompanied by a service animal. Basically, you can't fake having a service animal in almost half the states. ADA guidelines. Laws in America require employers, schools, landlords, and governments to make services accessible to persons with disabilities through the provision of reasonable accommodations or modifications. There's the right to healthcare. All disabled people legally have equal access to healthcare and the right to education and work. All disabled people have access to accommodations at work and school, except private schools, in order to get an education and work. So here are some support groups. You can follow me at Zebra Support Network on Eventbrite. I do these every month on the 6th of the month at 4 p.m. Pacific Standard Time. Facebook groups, there are lots of Facebook groups that are specifically for EDS and HSD support. The EDS Society also does monthly meetups. Some are by gender, some are by age, some are by type of EDS. And then the photo underneath says, "Justice anywhere is a threat to justice everywhere." And it's a march of many people in wheelchairs. So this is the end of my presentation. My next meeting is Disability Self-Advocacy. It's a 5-week course with a personalized plan that will start on April 11th at 4 p.m. Pacific Standard Time. And that you can get tickets there for free on Eventbrite under Zebra Support Network. If you have any questions, feel free to ask me. Oh, and then also here's all my contact info. My Instagram is ellersdanlos.events. My Facebook is, the page is Fighting Ableism. And if you want to follow me, I'm Emil L. McQueen. My Reddit is ellersdanlos_events. My website is also listed here, mfha.ke/fightableism. And then it's a photo of wheelchair dancing, one of my favorite things. Do you have any questions?
No,
Or
you did such a
comments?
great presentation.
Thank you.
Oh, of course. I'm amazed at how thorough you went through so many different talking points so quickly. You are gifted.
Yeah, well, and you probably wouldn't believe, but my first workshop was last month.
What?
Yeah.
I would, if you hadn't said anything, I would have thought this was like year 3. You
Yeah.
definitely don't show being a newbie at all. So
And I just started
grateful.
doing it because I wanted to raise awareness in a different way that I
Yeah.
could make more accessible than over social media.
Exactly. Oh, I'm for it. I'm all for it. And
Yeah.
I'm just
But
so
yeah,
glad I got to make this event.
like I said, thank you. Yeah, and like I said,